Virtual gambling addiction is a disorder that has become increasingly common recently with the growth of the digital world. Unfortunately, as gambling has moved from physical spaces into virtual ones, its prevalence has sadly continued to rise. While it's a disorder that mostly affects young men, recently its incidence has been increasing among people of every age group, every profession, and every gender. There may be different ideas about its causes, but it's mostly about the initial encounter with the disorder, and after that, the person's sensitivity to gambling, where genetic factors and the person's psychological state are very important. Then, unfortunately, the activation of what we call the dopamine system affects the development of addiction in the person. Clinically, we see these individuals unable to stop gambling, continuing their gambling habit even when they're in financial crises. And along with this, changes in their social, professional, functional, and academic lives. And unfortunately, later on, with the financial crises that emerge, we see them trying to find money and resorting to illegal means. The disorder is so serious that later on, anxiety, distress, depression, and other symptoms can also appear. Its treatment is, on one hand, very difficult. We shouldn't be pessimistic about this. But on the other hand, I can say that it's not easy enough to be optimistic. And in treatment, our approach is usually not one-sided. It requires the person themselves, their family, their social situation, medication, and psychotherapy to be done together. We know that clients generally have a tendency to want to get rid of their gambling habit. They usually express this themselves. But when we move on to the treatment process and express our expectations of them, they state that they are not very willing in this regard. Because if you ask what we expect from them, first, when we want to take away their financial freedom, for example, taking their credit cards, or if they are a salaried person, transferring their salary to a loved one, this could be a spouse or a parent. When we have these requests, and additionally, when we ask them to stay away from virtual environments, even to block their internet access, they do not act very willingly in this matter. The person's own participation is also a factor that determines the treatment. In conclusion, virtual gambling addiction is seen as a serious illness, and for the treatment of these patients, it is absolutely necessary to apply to a healthcare institution.